She wasn't supposed to be here. She was supposed to be somewhere else. Her gentle, nurturing persona, desire to help others, and family history of community service made her an excellent fit somewhere in the social services field. But not here, not in this space. Long before Meghan McCarthy added 2 very important letters, D.O., to her title, and changed the course of her life forever. 2 other letters guided her thoughts about possibly becoming a psychiatrist. N.O. No, she hadn't thought of herself as someone who would become a psychiatrist. No, she hadn't considered medical school. No, even if she hadn't even taken the science courses needed to go that route. But this isn't the story of the power of no. It's a story of mentorship, guidance, and persistence. It's a family tree of psychiatry, past, present, and future, neatly laid out and changing in real time. It's a story that plays a part in the evolution of behavioral health in Erie and the positioning for a healthier, happier community. And it all started and continues with a breakthrough.
I grew up in a family that was really dedicated to helping other people. My father was the director of a human service agency in town, and my mom really focused on health and nutrition and was really a balanced individual, helping kids and helping adults think about what they wanted to do, kind of to take care of themselves. And I saw myself doing something similar.
I would say that one of the things that stands out and stood out as an early child was how intuitive she is. There's experiences that I had with her in which it was a woman who ultimately was diagnosed with a mental illness, who laughed a lot, and it was awkward for adults. And Meghan said, I think she laughs, this is later, I think she laughs, but I don't think she's happy. She may have been 5. Yeah. And that sense of just seeing beyond the obvious that most children I don't think would have, but she did. I'm not surprised she ended up choosing a field like she's in.
I'd always thought that I would do something with regards to my career as, therapy or sitting with people and talking to them about what's going on in their lives, but I never ever considered like a career in medicine.
The 3 major influences were Penny Chapman, Dennis Borzon, and Marianne Aubach.
When I first met Dr. McCarthy, she was working at Community Integration. She was a graduate student, and we talked at that time about what she was doing and what her future ambitions were. I actually thought she would be a good candidate to go to medical school because she was bright.
I recall looking at how I might have her meet other women in the field, and so looking at helping her participate in a women's committee gathering that happens in Philadelphia. Thinking about, yes, I think you could go to medical school, why not?
And I said, I can't possibly do that. I never took a single science course in my career. I'm not prepared to go to medical school. I don't even want to go to medical school. And they said, you should really think about this. You know, you've spent all of this time interviewing patients and getting good at this, and we could see you really doing this. So I spent all my life savings and I went back to school. I was older to take all of these prerequisites for medical school and decided that I was going to try. I was only going to go to LECOM. I wanted to stay in town. I was really dedicated to this community. I took the MCAT one time and I passed and got in, and it's really remarkable that I ended up going into a career in medicine.
People said medicine, but it turned out quite wonderfully for her.
I, in fact, was her first residency director, or her only residency director, I guess, because I was working as the residency director at the hospital, at Mill Creek Hospital. So she spent 4 years there, completed a residency, and then went on and worked at Stairways for a couple of years.
I can't believe there's been that many years that have transpired. It's wonderful to see her growth and leadership.
And I feel very passionate about making psychiatry available to anybody who might need it. And so I show up because I want to be available. I feel like not everyone can do this or does do this or has this expertise. And I want to be able to sit with people when they are really struggling. I think it's a gift to be able to do this.
I would pick her for this field every single time. I could meet her in the grocery store and probably pick her for this field. I think one of the things I love the most about Dr. McCarthy's approach with patients, again, like regardless of the acuity level, we're meeting them where they're at and really offering a safe space. Offering a space for somebody to express what's going on, to be met without judgment.
She has really behind her an excellent grounding and basis in her clinical knowledge, in her ability to engage with others, and the leadership role to be able to distill information and find a path for everyone. It feels wonderful to have been able to support her and continue to support her in that process.
I remember we had a discussion a few years back about her possibly taking a job as a residency director at the hospital and to take over a job that I had done in the past. I actually encouraged her to do that because I think she is very responsible, very bright, and hard worker. And I thought that that would suit her well to do that job.
A lot of Dr. McCarthy's kind of core values are the humility and the empathy and kind of the selflessness. And I think what that translates to is you can kind of see that as, you know, you're training under her, that, you know, she's looking to support you the best that she can. She definitely puts, you know, people that she works with kind of first and takes care of them. And I think that translates to her encouraging us to do kind of more meaningful work or things that, you know, we can live up to our potential. And I think that kind of helps to, you know, help the community, help patients. And so I think she supports us in that way that she, you know, can help improve patient care.
Well, I think it's really important to remember the human aspect to taking care of patients. And I like to talk to the residents about this too. You know, when I'm talking to people about how do you become a psychiatrist, I talk to them also about like their own growth and development and understanding that they bring themselves into the room with other people and that they are bringing themselves as human beings into the room with other human beings. And that this is about relationships. I think the relationships matter the most. And I think that I bring that to teaching other people, that this is really, really important part of the job.
And as we watched her grow into this job, I have heard and seen her teach people that about being human.
So initially I didn't know what I wanted to do. I wasn't sure if I wanted to do psychiatry or something else until my first rotation with Dr. McCarthy. I was lucky enough to work with her, and I saw one of the most competent, compassionate, empathetic people I'd ever seen. She had this wonderful ability to take people in crisis and make them feel comfortable even in their own crisis. And I just knew at that moment that I wanted to do that. So.
If I don't get into your program, I'm either gonna soap into Family Med or I'm gonna get into Family Med, and I'm gonna reapply every single year until you accept me. Because I wanted to work with her, like I wanted to learn from her. I just felt like at home. And Dr. McCarthy, I think, was one of the first people to really make me feel like validated as a student doctor, as a mom. It felt really nice to be able to connect with her on that level and felt like really seen and heard. So I mean, she's definitely an inspiration and influences my everyday as a resident psychiatrist.
And she's also one of the reasons I decided to stay on as an attending after my residency. So I want to work alongside her as a colleague.
So many people, I think, have decided to stay in Erie and practice in Erie, or at least in the surrounding areas. So yeah, we've really, I think, been able to do what the program set out to do, and that is to have people stay close by and do this work here.
We are very lucky as a community to have the residency program thriving, and that's what we want. This has been an area where when I was much younger in my career, how would we recruit and retain folks? And now we have this strong mechanism of which she holds a leadership role in that residency program to help mentor and train psychiatrists that some will stay in this community, some will share their knowledge in other spaces, and it is truly wonderful to see that occurring.
I don't know if there's a single program on the planet where you'll have a program director who, A, still sees the amount of patients that a full-time psychiatrist would, B, provides the level of support that she does, and then isn't afraid to go to bat for us when it really counts. So, I mean, we're very lucky to have her. We sell that as our #1 point. When we're interviewing students, when we have people interested in our program, we're like, I don't know where you're gonna find a better program director.
For her to be the person that she is, teaching others to do this work, that's exactly what this field needs. This field cannot just emulate medicine. I mean, we all want kind doctors. We all want empathic doctors. But your surgeon doesn't have to be terribly empathic. He or she just needs to be really good at doing the job. That's not enough in psychiatry. You've got to be a really good human being in addition to being a good doctor. And she's both.